Movember is an annual event where men all over the world grow moustaches during the month of November to raise awareness about men's health issues. I'm delighted to welcome today Dr. Donna Robinson, who is founder and director of MedConsult. Dr. Donna, in your experience, what are the main health issues that men face today?
Well, men are the same as women. We face health issues affecting our lives. It's going to be cancers, it's going to be cardiovascular disease, and then there's other problems that maybe men don't talk about as much, like stress, depression, hormones.
Focusing on one of those points you mentioned, what should men know about the risks of prostate cancer and testicular cancer?
Well, first of all, did you know testicular cancer is rare, but it's easily spotted because a younger man, maybe 20 to 35 years, may notice a lump on the testis and they'll have it treated. An older man, prostate cancer, you may notice symptoms, but the two screening tests that you do need to know about, I think you do need to know, the PSA test, prostate specific antigen test, and the perhaps not so comfortable test is the digital rectal examination. And everyone over 40, 45, men over that age should be aware of that. Very, very straightforward blood test.
So, for you as a doctor, what do you think is the key to early cancer detection, diagnosis and treatment?
For prostate cancer, well, I think prostate cancer is a big concern of men because they've all known someone and maybe they could be frightened of the treatments that could affect their whole body, their sexual function, their whole life. So knowing to get the blood test, I think, is very important. And it doesn't even cost much. Just go along, get the test. And the treatments, luckily, are getting easier.
Okay. Moving on to mental health, how do these issues manifest themselves in men these days?
Well, men don't usually talk about problems, do they? Women may be very emotional, going to the doctor regularly. Men don't always go to the doctors. Mm-hmm. In fact, they might research and do it all on Google themselves, which is fine. What we're concerned about for men is, the rate of suicide is higher than for women. Women may attempt, women may get depressed often. So that really concerns me about men. And when men are depressed, it's a red flag. We really want to do everything for you, get you counseling, seeing a psychiatrist, get you on medication.
That follows on nicely to the next question. How should men adopt a lifestyle that positively affects their mental and physical health?
A lifestyle? Well, I mean, we can all tell people to be fit, to go running, to not smoking, not drink too much alcohol. But you know what? Everybody's just human. And if we can just manage one little thing at a time, maybe a tiny time, I'll say, oh, it's really easy. Just try this, why don't you just try, perhaps if you've got high cholesterol and you need it treated, just try half a tablet of this. Make it sound easy for people, because it is difficult to be the perfect human being.
Sure, absolutely. Dr. Donna, are there any health issues that we haven't discussed yet?
Yeah, I think there are. What about men's hormones? What about the male menopause? Even men losing hair. It's a big concern for men these days. But the male menopause, the drop in the hormones. Women have talked about their hormones. I was looking, women got HRT in 1965. Which men talk about their hormones, the changes as they age? Now, we do testosterone testing, and men's hormone replacement therapy is available. Of course, men should have the same opportunities as women. That's what I feel.
Excellent, excellent. Tell us a little bit more about MedConsult.
Well, MedConsult is a clinic. We opened it, first of all, in 2003. not really knowing how a business runs. I think now we know how a business runs, since we were lucky enough to get a King Power British Chamber Award. So we're a clinic. What do? Well, we do what the customer wants. What do patients want? And they come in and they say, oh, can you check my cholesterol? Oh, can you provide these medicines? By the way, can I look more beautiful? Can I do some Botox and fillers? So we're driven by what the customer wants, I think, as any business is. And again, in Bangkok, we're a clinic out there, but there's a lot of competition, and we've really got to reach to the highest standards.
Thank you, Donna. MedConsult has been a member of the BCCT for many years, and Donna and her team are regular attendees at BCCT events. So please do say hello when you next see them.